Maya Chen sat quietly in the corner of the hospital cafeteria, her small frame hunched over a cup of lukewarm coffee. At 24, she looked even younger, with delicate features and a soft voice that barely rose above a whisper. Her colleagues at Street, Mary's hospital had grown accustomed to overlooking her during staff meetings, assuming she had little to contribute to the bustling emergency department where she worked as a nurse. Dr. Richardson, the head of emergency medicine, barely acknowledged her presence during the morning briefing. He directed his attention to the more experienced nurses, those with commanding voices and assertive personalities. Maya had learned to accept this treatment over the past 18 months of working there. She understood that people saw her quiet demeanor and petite stature as signs of weakness or inexperience. The other nurses often made comments that stung more than they realized. Sarah, a veteran nurse with 15 years of experience, would often say things like, "Maya, dear, why don't you handle the less complicated cases today?" 2. Or Jennifer would suggest, "Maybe you should observe while I handle this trauma patient. It might be too intense for you." These words were delivered with what seemed like genuine concern. But Maya felt the underlying message clearly. They believed she was too fragile for the demanding world of emergency medicine. What her colleagues didn't know was that Maya had graduated top of her nursing class from one of the most prestigious programs in the country. She had specifically chosen emergency medicine because she thrived under pressure, not despite it. Her quiet nature wasn't a sign of weakness. It was her way of observing, learning, and processing the chaos around her before acting with precision. Maya had grown up in a household where her grandmother, a former army medic, had taught her that true strength often came disguised in unexpected packages. Her grandmother would tell stories of the war, where the most effective medics were often the ones who stayed calm and observed carefully before making their moves. These lessons had shaped Maya's approach to everything in life. On this particular Tuesday morning, the emergency department was unusually quiet. The autumn air had brought fewer accidents, and the usual stream of patients seemed to have slowed to a trickle. Maya was assigned to the pediatric section, as usual, handling what the other nurses considered the easier cases. She didn't mind working with children. Their honesty and resilience reminded her why she had chosen this profession. Around 11 o'clock, the quiet was shattered by the piercing sound of multiple ambulance sirens approaching the hospital. The radio crackled to life with urgent reports of a major accident on the interstate. A school bus carrying 32 children had collided with a truck, and multiple casualties were incoming. The estimated time of arrival was less than 10 minutes. Dr. Richardson's voice boomed across the emergency department as he began coordinating the response. Nurses scattered to prepare trauma bays, gather equipment, and set up triage areas. The atmosphere shifted from calm to controlled chaos in a matter of seconds. Maya felt her heart rate increase, but not from anxiety, from anticipation. This was the moment she had been training for her entire career. As the first ambulances arrived, Maya watched from her position near the pediatric bay. She could see the fear in her colleagues' eyes as they realized the magnitude of what they were about to face. Treating multiple injured children simultaneously was every healthcare worker's nightmare scenario. The pressure to save young lives while managing distraught parents and maintaining professional composure was overwhelming even for the most experienced staff. The first stretcher came through the doors carrying an 8-year-old boy with obvious signs of internal bleeding. His face was pale, and his vital signs were dropping rapidly. Dr. Richardson immediately took charge. But Maya could see the tension in his movements. The second ambulance brought in twin girls, both unconscious with head injuries. A third child arrived with multiple fractures and a punctured lung. What happened next would change everything Maya thought she knew about herself, and everything her colleagues thought they knew about her. As she stood in that moment, watching the controlled chaos unfold around her, something deep inside her activated. It wasn't panic or fear. It was a crystal-clear focus that she had never experienced before. The senior nurses were struggling to keep up with the influx of critical patients. Sarah was visibly shaking as she tried to establish an IV line on one of the unconscious girls. Jennifer was fumbling with equipment, her usual confidence shattered by the severity of the situation. Even Dr. Richardson, normally unflappable, was showing signs of being overwhelmed by the sheer number of critical decisions required. Maya stepped forward from her corner, her movements suddenly fluid and purposeful. She approached the trauma bay where the 8-year-old boy was struggling for life. Without waiting for permission or instruction, she began assessing his condition with a speed and accuracy that surprised everyone around her. Her hands moved with practiced precision as she checked his pupils, monitored his breathing, and quickly identified the source of his internal bleeding. "He needs immediate surgery," Maya said, her voice clear and confident for the first time since anyone could remember. "His spleen is ruptured, and he's going into shock. We need to get him to OR3 immediately." "Doctor?" Richardson looked at her with surprise, but the accuracy of her assessment was undeniable. The boy's symptoms perfectly matched her diagnosis. As Maya continued to work, something remarkable began to happen. The quiet, fragile nurse that everyone thought they knew was transforming before their eyes. She moved between patients with an efficiency that left the veteran staff speechless. Her assessments were rapid and accurate, her hands steady, and her voice calm even as she delivered urgent instructions. She quickly identified that one of the twin girls had signs of increased intracranial pressure and needed immediate intervention to prevent brain damage. While other nurses hesitated, uncertain about the complex neurological signs, Maya was already preparing the necessary equipment and medications. Her knowledge of pediatric emergency medicine was proving to be far more extensive than anyone had imagined. The transformation was so complete and unexpected that several staff members found themselves stopping to stare. This was the same woman who just hours earlier had been sitting quietly in the corner, overlooked and underestimated by everyone around her. Now she was moving through the emergency department like a seasoned professional with years of trauma experience. Dr. Richardson found himself following Maya's lead rather than directing her actions. Her clinical instincts were proving to be exceptional, and her ability to prioritize care in a mass casualty situation was something he had rarely seen. Even among his most experienced staff, the fragile facade had completely disappeared, replaced by a competent and confident medical professional. As more ambulances arrived with additional injured children, Maya's response only intensified. She seemed to have an unlimited capacity to process multiple critical situations simultaneously. While other staff members became increasingly frazzled, Maya became more focused and efficient. It was as if the pressure and chaos were fuel that powered her performance, rather than obstacles that hindered it. The pediatric emergency area, which had been selected for Maya because it was considered less demanding, had become the epicenter of the most challenging medical situation the hospital had faced in months, and the nurse everyone had assumed was too fragile to handle serious cases was proving to be the most capable person in the room. Maya's colleagues began to realize that everything they thought they knew about her had been completely wrong. The quiet demeanor they had mistaken for weakness was actually the calm confidence of someone who observed before acting. The soft voice they had dismissed was actually the controlled communication of someone who spoke only when necessary. The small stature they had seen as fragile was actually the efficient frame of someone who moved with purpose and precision. As the crisis continued to unfold, it became clear that Maya's response was not just competent, it was extraordinary. The assumptions everyone had made about her capabilities were being shattered with each passing minute. And what was emerging in their place was something that would astonish everyone who witnessed it. Within the first hour of the crisis, Maya had successfully stabilized 4 critical patients and identified life-threatening conditions that other nurses had missed. Her ability to remain calm under extreme pressure was becoming legendary among the staff who witnessed it. Word began spreading throughout the hospital about the remarkable transformation they were seeing in the pediatric wing. Dr. Martinez, the chief of pediatric surgery, arrived to assess the situation and was immediately struck by the level of organization he found. Instead of the chaos he had expected from such a massive emergency, he discovered a well-coordinated response, led by someone he didn't initially recognize. When he realized it was Maya, the quiet nurse he had barely noticed during previous rotations, his surprise was evident. Maya was coordinating with multiple departments simultaneously, ensuring that surgical teams were prepared, that blood products were available, and that families were being properly informed about their children's conditions. Her communication skills, which had previously seemed limited, were now revealing themselves to be precise and effective. She spoke with surgeons using complex medical terminology, translated complicated procedures for frightened parents, and directed support staff with clear, actionable instructions. The most remarkable aspect of Maya's transformation was her ability to connect with the injured children themselves. While other staff members focused primarily on medical procedures, Maya somehow found time to provide emotional comfort to her young patients. She would speak to them in soothing tones, explain what was happening in age-appropriate language, and provide reassurance even during the most frightening procedures. 8-year-old Tommy, the boy with the ruptured spleen, had been terrified when he first arrived. Maya had stayed with him during his initial treatment, holding his hand and explaining each step of his care. Her presence had such a calming effect that his vital signs actually improved, making the surgical intervention more successful. The surgical team later commented that they had rarely seen a child so calm before emergency surgery. As the day progressed, more ambulances arrived with additional casualties from secondary accidents that had occurred due to traffic backing up from the original crash site. What had started as a school bus accident was expanding into a multi-vehicle incident, with adult casualties as well. The hospital was quickly reaching capacity, and every available staff member was being called to assist. Maya found herself being consulted by doctors and nurses throughout the hospital, not just in pediatrics. Her reputation for accurate assessments and calm decision-making was spreading rapidly. Dr. Richardson, who had barely acknowledged her presence that morning, was now actively seeking her input on complex cases. The irony was not lost on Maya, but she remained focused on the patients rather than the dramatic shift in how she was being perceived. The most challenging case of the day arrived around 3 o'clock in the afternoon. A 10-year-old girl named Sophie had been trapped in the wreckage for over an hour before being extracted. She had multiple injuries, including a severe head trauma, internal bleeding, and complications that the initial assessment team couldn't fully identify. Her condition was deteriorating rapidly, and the medical team was struggling to determine the best course of treatment. Maya approached Sophie's trauma bay and immediately noticed subtle signs that others had missed. The child's breathing pattern suggested a specific type of chest injury that was being masked by her other, more obvious wounds. Her neurological responses indicated a particular type of brain injury that required immediate and precise intervention. Maya's assessment revealed that Sophie had a combination of injuries that created a complex medical puzzle requiring carefully coordinated treatment. Working with Dr. Rodriguez, the trauma surgeon, Maya helped develop a treatment plan that addressed Sophie's multiple injuries in the correct sequence. Her knowledge of how different injuries interacted with each other proved to be crucial in saving Sophie's life. The surgical team later acknowledged that without Maya's insights, they might not have identified the correct treatment approach in time. While Maya was working to save Sophie's life, something else remarkable was happening throughout the hospital. Other nurses and doctors were sharing stories about her performance throughout the day. People who had worked alongside her for months were discovering capabilities they never knew existed. The narrative about Maya being fragile and inexperienced was being completely rewritten with each new example of her expertise. Jennifer, one of the nurses who had often suggested Maya wasn't ready for complex cases, found herself asking Maya for advice on a difficult IV placement. Sarah, the veteran nurse, was watching Maya coordinate multiple teams and realized that her own approach to crisis management could be improved by observing Maya's methods. The dynamic in the emergency department was shifting as staff members recognized that their assumptions about Maya had been fundamentally incorrect. The hospital administrator, Mrs. Peterson, had received reports about the exceptional response to the mass casualty event and decided to observe the situation personally. She expected to find the usual controlled chaos of an emergency response, with senior staff taking leadership roles and newer employees providing support. Instead, she discovered that much of the coordination was being led by Maya, someone she remembered as a quiet, unassuming nurse who rarely spoke during meetings. Mrs. Peterson watched as Maya seamlessly moved between treating patients, consulting with doctors, and coordinating with other departments. Her leadership style was unlike anything the administrator had seen before. Rather than commanding through authority, Maya was leading through competence and calm confidence. People followed her directions because they trusted her judgment, not because they were required to obey her. The most surprising discovery for Mrs. Peterson was learning about Maya's educational background. A review of her personnel file revealed that Maya had not only graduated at the top of her nursing class but had also completed additional certifications in pediatric emergency medicine, trauma care, and crisis management. All of this training had been completed on her own time and at her own expense, yet she had never mentioned it or asked for recognition. As the evening shift began, the immediate crisis was finally under control. All of the children from the bus accident had been stabilized, and most were expected to make full recoveries. The secondary casualties from the traffic incidents had also been treated successfully. The hospital's emergency response had been remarkably effective, largely due to Maya's unexpected leadership during the most critical hours. Dr. Richardson called an impromptu debriefing meeting to discuss the day's events and identify lessons learned for future emergencies. As the staff gathered in the conference room, there was an unusual energy in the air. Everyone was looking at Maya with new eyes, seeing someone they thought they knew but clearly had never truly understood. The debriefing session revealed the full scope of Maya's contributions to the successful response. She had been involved in treating nearly every critical patient, had provided crucial insights that saved multiple lives, and had coordinated activities that prevented the situation from becoming chaotic. Her quiet observations and careful assessments had proven to be more valuable than the loud, assertive approaches that had previously been favored. Maya herself seemed somewhat surprised by all the attention she was receiving. From her perspective, she had simply done what needed to be done. The crisis had required her to step forward and use her training, and she had responded naturally to that need. She didn't see her actions as extraordinary. She saw them as the logical response to an emergency situation. However, it was becoming clear to everyone else that Maya's response had been anything but ordinary. Her combination of technical expertise, calm leadership, and compassionate patient care had set a new standard for emergency response at the hospital. The fragile image that everyone had projected onto her was being. The weeks following the bus accident brought dramatic changes to Maya's role at St. Mary's Hospital. Dr. Richardson had submitted a detailed report to the hospital administration, highlighting Maya's exceptional performance during the crisis. The report included testimonials from multiple doctors, nurses, and support staff who had witnessed her transformation from a seemingly fragile newcomer to a confident leader in emergency medicine. Mrs. Peterson scheduled a private meeting with Maya to discuss her future at the hospital. During this conversation, Maya finally had the opportunity to share her background and explain why she had remained quiet about her extensive training and qualifications. She revealed that her grandmother's military experience had taught her the value of proving herself through actions rather than words, and that her quiet observation period had been intentional preparation for moments exactly like the bus accident. Maya explained that she had been studying the hospital's procedures, learning the personalities and working styles of her colleagues, and identifying areas where improvements could be made. Her silence hadn't been due to lack of knowledge or confidence. It had been strategic preparation. She had wanted to understand the existing culture before suggesting changes or demonstrating her full capabilities. The administration was astounded to learn that Maya had been essentially conducting an extended assessment of their emergency response procedures. Her observations during the crisis had revealed several areas where their protocols could be improved, and her suggestions for enhancement were both practical and innovative. What they had interpreted as a new employee learning the ropes had actually been an expert analyzing their systems. Within a month, Maya was offered a promotion to senior emergency nurse, with special responsibilities for crisis coordination and staff training. The position had been created specifically for her. Recognizing that her unique combination of technical expertise and calm leadership represented a valuable asset that the hospital had never properly utilized. Maya's new role involved developing training programs to help other staff members improve their crisis response capabilities. She worked with Dr. Richardson to create simulation exercises that would prepare the emergency department for future mass casualty events. Her approach to training emphasized the same careful observation and strategic thinking that had characterized her own professional development. The transformation in how Maya's colleagues perceived and interacted with her was remarkable. Sarah, the veteran nurse who had previously treated Maya as inexperienced, became one of her strongest supporters and advocates. She often commented that working with Maya had taught her that experience and expertise could manifest in unexpected ways, and that assumptions about colleagues based on surface impressions were often completely wrong. Jennifer, who had frequently suggested that Maya wasn't ready for complex cases, found herself learning new techniques and approaches from Maya's teaching sessions. The irony that she was now receiving training from someone she had previously considered unprepared was not lost on her, but she embraced the learning opportunity with genuine enthusiasm and humility. Dr. Martinez, the pediatric surgeon, began specifically requesting Maya's assistance on complex cases involving children. Her ability to connect with young patients and provide emotional comfort while maintaining clinical precision had proven to be invaluable in improving both medical outcomes and patient satisfaction. Several families had specifically mentioned Maya's compassionate care in their feedback to the hospital administration. The success of Maya's training programs began attracting attention from other hospitals in the region. Her innovative approaches to crisis preparation and her methods for identifying hidden expertise among staff members were being studied and replicated at other medical facilities. Maya found herself being invited to speak at nursing conferences and medical symposiums about her experiences and insights. One particularly meaningful moment occurred 6 months after the bus accident, when Sophie, the 10-year-old girl with complex injuries, returned to the hospital for a follow-up appointment. She had made a complete recovery and specifically asked to see Maya to thank her for saving her life. Sophie's parents credited Maya not only with providing excellent medical care but also with giving their daughter the courage and comfort she needed during the most frightening experience of her young life. The reunion with Sophie reinforced Maya's understanding of why she had chosen emergency medicine as her specialty. The ability to make a difference in people's lives during their most vulnerable moments was what drove her passion for the profession. The recognition and advancement she had received were gratifying, but the real satisfaction came from knowing that her skills and dedication had directly contributed to saving lives and healing injuries. Maya's story became legendary within the hospital, but not just as an example of hidden talent being discovered. It became a teaching tool about the importance of not making assumptions about colleagues based on personality traits or communication styles. The hospital implemented new policies for recognizing and utilizing diverse types of expertise, ensuring that future Maya Chens would be identified and supported much earlier in their careers. Dr. Richardson often used Maya's story in his presentations about team dynamics and leadership in medical settings. He emphasized that the most effective teams were those that could recognize and leverage different types of strengths, rather than only valuing the most obvious or vocal contributors. Maya's quiet competence had proven to be just as valuable as more traditional forms of medical leadership. The broader lesson from Maya's experience extended beyond the medical field. Her story demonstrated that strength and capability could manifest in ways that defied conventional expectations. The assumptions that people made about her based on her quiet demeanor and small stature had prevented them from recognizing her true potential for months, but had also allowed her to observe and prepare in ways that ultimately made her more effective when action was required. Maya's grandmother, who had passed away 2 years before the bus accident, would have been proud to see how the lessons about quiet strength and strategic observation had served her granddaughter so well. The military wisdom about proving oneself through actions rather than words had guided Maya through the challenging period of being underestimated, and had ultimately led to her emergence as a recognized leader in her field. As Maya settled into her new role and continued to develop innovative approaches to emergency medicine, she remained mindful of the colleagues who might be following a similar path. She made it a priority to identify and mentor staff members whose talents might not be immediately obvious, ensuring that the hospital would benefit from all available expertise, rather than only the most visible contributions. The transformation that had astonished everyone who witnessed it served as a permanent reminder that assumptions about people's capabilities could be dramatically wrong. Maya's story became part of the hospital's culture, encouraging staff members to look beyond surface impressions and to create environments where all types of talents could flourish. Maya Chen had proven that being underestimated could sometimes be an advantage, allowing for careful preparation and strategic development that ultimately led to extraordinary performance when the moment demanded it. Her journey from overlooked nurse to recognized leader demonstrated that true strength often came disguised in the most unexpected packages, waiting for the right moment to reveal itself and astonish everyone who had failed to see it. Replaced by a recognition of her true capabilities and potential.